going to be your student nurse today doing your postpartum assessment. Can you tell me your name and date of birth?
My name is Marcia Conde, and my date of birth is February 22, 1989.
Okay. Can you tell me how you're feeling?
I'm feeling good.
Yeah, how is the baby?
It's fun. It's a totally new experience to me.
Yeah.
Yeah, that's my first child,
Oh, that's so exciting. What's the baby's name?
Mario.
Mario. Okay.
Yes.
Well, I'm just going to come here and assess you. I'll check your vitals first. Are you in any pain right now?
Not right now.
No? Okay. I'm going to take your blood pressure. Okay, 120/80, that's normal. Take your heart rate. You got 72 beats per minute, that's normal. Your respiratory rate, you got 12 per minute, which is normal. And then I'm going to take your temperature, and it's 98.8, which is normal. I'm going to go ahead and assess your breathing. So if you could just take some deep breaths for me. Actually, let me reposition you. If you could just sit up. Okay. I'm going to assess your breathing. So if you take some deep breaths for me. Okay, everything looks good. I'm going to go ahead and auscultate the heart. This is aortic, pulmonic, Erb's point, the T1, and mitral. And it sounds good. All right, the lungs in the back sound good. I'm going to go ahead and do some CVA tenderness on you. Let me know if this hurts.
No.
No? Okay. I'll lay you back down. I'm just going to examine your breasts real quick. Are you having any trouble breastfeeding or any weird sensations on your breasts?
No.
No? Okay. Then I do see some striae, some stretch marks. They do look a little swollen. Does it hurt
No.
when I touch it? No?
No.
The baby's latching on just fine, or have you tried to breastfeed yet?
I tried it. It's not good.
Okay. Well, next time you do feed the baby, call me on the call light and I can run over and see if it's if the baby's latching on, okay? I'm gonna check your uterus now. So I'll just lift this, and your linear negra seems to be diminishing. You do have some striae here, so I'm gonna palpate for the uterus, and there's some blood clots coming out. The blood looks normal. It's the uterus is in the middle, the umbilical. So we palpate the bladder. Are you having trouble voiding?
No.
No? Okay. Do you know how much you're voiding whenever you go?
I don't know.
No? Okay. Well, I can leave a urinary pan to catch when you void. That way I can see how much you're going to make sure that you're not having any urinary retention. All right. And then I'm just going to have you roll over to make sure you're not bleeding from the back. Nope. There's no odor. Let me check your incision. Okay. And everything looks good. There's no swelling in that. Now I'm just going to assess for any DVTs, which no heat, no swelling in both of the legs. So I think you're all good there. Let me just check your reflexes real quick. I know you're coming off the epidural. Okay. Okay. All right, well, your reflexes are looking good. Do you notice any sweating at night or excessive sweating?
Yes.
Yeah. Well, that is normal. You are having a lot of fluids being put into your body, so if you do notice any excess sweating or excess peeing, that is totally normal. Now, just want to educate you when you leave the hospital. Make sure you do not do strenuous exercise. Don't lift anything more than just your baby. We want to make sure you're healed. And yeah. All right, well, thank you for letting me do this assessment on you. I am student nurse Rebecca. I'm going to be doing a newborn assessment on baby David. So I will start by taking baby's weight, and this is my scale. I've already done hand hygiene. Baby weighs 10 ounces, which is normal. I'm going to go ahead and take his height. So baby is 14 inches or 36 centimeters. I'm going to do the head circumference, which is 10.5 inches or 26 centimeters. The chest circumference, just 9 inches or 23 centimeters, and then over the belly, which is 9.5, 24 centimeters. I'm going to go ahead and take baby's vitals with the smaller stethoscope for a full minute. Baby's heart rate is 130, which is normal. And while I'm here, I'm going to listen to the breath sounds. All right, lungs sound okay, and I'm going to feel for respirations. And baby's respirating at 50 breaths per minute, which is normal. I'm going to go ahead and listen to the bowel sounds. All right, and the bowels sound normal. Take baby's temperature in the armpit. Baby's temperature is 37 degrees Celsius. That is normal. And baby seems to be in pain. Okay, so baby's skin looks nice and even, very soft, not sticky. The texture is very smooth. There's a little vernix here in the armpits and the inguinal area. No rash, no Mongolian spot. I'm going to go ahead and check baby's reflexes now. So, baby shake. Okay, so the Moro reflex was okay. Blinking, baby's blinking. I'm looking for pupillary reflex, and that seems to be present. I'm going to check the rooting now. All right, and the baby's sucking okay. While I'm here, I'm going to check the palate, and that seems to look normal. Do the Palmer reflex and the plantar reflex. Let's see, we'll do the Babinski. All right, that seems normal. Move the baby's neck, and the baby will move its arm with it. And then the other side. Okay. Turn to the side and do the trunk reflex, and then do the crawl. And I'm examining baby's buttocks. All right. looking at the head, the size and shape looks pretty normal. It's not really a cone head, not too flat. Normal, there's no molding, no, nothing in the sutures. And the neck and the clavicle looks normal. The face, eyes are in line with the ears. The nose is small and slightly flat. The mouth is symmetrical. Nothing abnormal there. Let's see, ear recoil. Ear recoil's fine. As far as the eyes go, the whites are white with a sclera. Baby's eye color is brown, symmetrical, and able to look. Okay. And as far as his chest area, he is breathing okay with expansion and retraction. Nipples seem to be symmetrical. There's no bulging or anything. The umbilical cord is clamped and is drying. The baby is moving his arms and his hands, which shows that he's got reflexes. And then I'm going to do the little hip maneuver to make sure his hips and his legs are working. Examine the baby's spine. It's a normal C shape, that's normal. Assess baby David's genitalia. He is a male, so I'm gonna look at his penis, and then I'm gonna palpate the testes and assess the scrotum. There's no apparent jaundice that I see, and for normal elimination, we want to expect on the first day 1 wet diaper, and then second day 2 wet diapers, 3 days 3, and so on until the 7th day, and that should be normal. But yeah, we got a healthy baby David.